Welcome to Health 365. In today's session, we'll be taking a closer look at follicular lymphoma, one of the most common types of non-Hodgkin lymphoma. We'll cover what it is, how it develops, its symptoms, how it's diagnosed, and what modern treatments are available. Whether you're a patient, a caregiver, or just someone trying to understand this condition better, this overview will give you clear, reliable information, all in simple language. Let's start with the basics. Follicular lymphoma is a type of blood cancer that affects a group of white blood cells known as lymphocytes. These cells are a vital part of your immune system. They help your body fight infections and keep you healthy. Normally, lymphocytes grow, do their job, and then die off naturally. But in follicular lymphoma, these cells begin to grow and multiply uncontrollably. The term follicular comes from the way these cancer cells arrange themselves in clusters, or follicles, inside the lymph nodes, which are structures that filter harmful substances from the body. Because the cancer grows slowly, follicular lymphoma is often described as an indolent or slow-growing type of non-Hodgkin lymphoma. Many people are surprised to learn that they have follicular lymphoma because it can develop quietly over time. In fact, some people are diagnosed during a routine checkup or after a scan for something unrelated. Common symptoms can include painless swelling of lymph nodes, often in the neck, armpits, or groin, along with fatigue, night sweats, unexplained fever, or weight loss. Some patients may also experience a feeling of fullness or discomfort in the abdomen due to an enlarged spleen. So what actually causes follicular lymphoma? The exact cause isn't fully understood, but researchers believe it begins with genetic changes inside the lymphocytes. One common change is called the 214/18 translocation, which causes a gene known as BCL2 to stay switched on. This prevents the cell from dying when it should, allowing it to survive and multiply. Over time, these abnormal cells accumulate and form clusters inside lymph nodes and other parts of the body. While follicular lymphoma is not usually inherited, certain risk factors can increase the chances of developing it. These include being over the age of 60, having a weakened immune system, previous exposure to radiation or certain chemicals, and, in some cases, chronic infections. However, it's important to remember that most people with these risk factors will not develop lymphoma. Now, let's talk about diagnosis. When doctors suspect lymphoma, they'll typically start with a physical exam and some blood tests, but the key step is usually a biopsy, which involves removing a small piece of tissue from an enlarged lymph node and examining it under a microscope. This allows doctors to confirm the type of lymphoma and how advanced it is. Additional tests like CT scans, PET scans, or bone marrow biopsies may be done to see if the disease has spread. Once the diagnosis is confirmed, follicular lymphoma is classified into stages, from stage 1 to stage 4. The stage depends on how many lymph nodes or organs are affected. But here's an important point. Because this type of lymphoma grows slowly, doctors also consider something called the tumor burden, which is basically how much disease is present and whether it's causing symptoms. This brings us to treatment. Interestingly, not everyone with follicular lymphoma needs treatment right away. In early or mild cases, doctors may recommend what's known as watchful waiting or active surveillance. That means regular checkups and monitoring, but no immediate therapy. Studies show that delaying treatment until symptoms appear doesn't harm long-term outcomes, and it helps patients avoid unnecessary side effects. When treatment is needed, the options depend on the stage, symptoms, and overall health of the patient. The most common approach includes immunotherapy and chemotherapy, often combined. A drug called rituximab is one of the cornerstones of treatment. It's an antibody that specifically targets and destroys cancerous B cells while leaving most healthy cells unharmed. Sometimes rituximab is used alone. Other times, It's combined with chemotherapy drugs in regimens known as R-CHOP or R-bendamustine. In recent years, new therapies have brought even more hope. Targeted therapies, like PI3 kinase inhibitors and EZH2 inhibitors, attack specific pathways that cancer cells rely on to grow. These treatments often have fewer side effects than traditional chemotherapy. There are also radioimmunotherapy treatments, where radioactive material is attached to antibodies that deliver radiation directly to cancer cells. And for patients whose lymphoma returns or becomes more aggressive, stem cell transplantation or newer options like CAR T-cell therapy may be considered. CAR T-cell therapy is an exciting advancement where a patient's own immune cells are re-engineered to recognize and kill lymphoma cells. While follicular lymphoma is generally not considered curable, it's often very manageable. Many people live for years, even decades, with the disease under control, experiencing long periods of remission between treatments. The key is ongoing follow-up with your healthcare team and living a healthy lifestyle. So what can you do if you or a loved one is diagnosed? First, remember, follicular lymphoma is not your fault. It's a condition that happens due to changes deep inside the body's cells. Stay informed, ask questions, and work closely with your doctor. Focus on nutrition, staying active, managing stress, and maintaining emotional well-being. Support groups and patient communities can also be incredibly valuable, helping you connect with others who understand what you're going through. Before we wrap up, here's a quick summary. Follicular lymphoma is a slow-growing type of non-Hodgkin lymphoma that affects lymphocytes, the white blood cells that help fight infection. It can often be managed for many years through a combination of observation, immunotherapy, and targeted treatments. Advances in medicine mean that outcomes are improving all the time, and new therapies are offering real hope for the future. If you found this video helpful, please give it a thumbs up and share it with anyone who might benefit. And don't forget to subscribe to Health 365 for more clear, science-backed health information and updates on cancer research and treatment. Thank you for joining us today. And remember, awareness, early diagnosis, and proper management can make all the difference. Stay informed, stay hopeful, and stay healthy.